In this video, we're going to discuss things related to female reproductive health. So we're going to talk about periods, we're going to talk about yeast infections, we're going to talk about vaginal pain and intercourse, sexual desire, and we're going to talk about breast symptoms as well. Dr. Petersons, I know that this is among your favorite things to talk about, so I'm going to let you lead us off today.
Yes, I always say if I didn't do PANS, I would do women with reproductive health concerns. And, off the top, also cyst or ovary concerns or ovarian pains can be useful symptoms, and PCOS, that diagnosis can be helpful. Along with that, any kind of bladder or uterine pains or discomforts, pelvic cramping, if it feels like you're going into labor every time you have your period. Those are really important symptoms to report. Along with that, the timing and duration of menses is so important. And now that we have those period tracking apps, much easier to track. But knowing that whether it's shorter than 28 days or longer than 28 days, because that's very characteristic, along with, do you flow for a really long time? Is it heavy or is it super scanty? Is the blood, brown? Is it thick? Is it mucousy? Does it have big, baseball-sized clots? Is the blood excoriating, meaning does it cause any vaginal irritation? Does it smell bad? Does it have any, is it super dark or super light? All of that can be really useful for female menstruation symptoms.
As well as any other times of the month that you might have any spotting. So if there's bleeding outside of the normal menses, discharge as well outside of blood can be really useful. So do you have the acrid or burning or excoriating leukorrhea? Is it thick? Is it cheesy? Is it thin? Is it watery? And the vaginal discharge does change throughout the course of the month, so just keeping an eye on that. But if you have anything that's significant or in volume or unusual for you, that's also a really useful information.
And then timing of symptoms, if it's stuff that's always happening right before menses and goes away the minute that your period starts, or everything is just during the period and ends right when the period ends, or if other symptoms come on like PMS and PMDD, mental emotional symptoms that are triggered because of your period or ovulation, things like that can be useful.
We also want to look at things like the pain or any other sensations associated with it. So it could be pain with periods, so cramping type of sensations. It could be pain with intercourse. It could just be sensitivity of the genitalia overall. So if you have genitals that are so sensitive that like you can't wear pants, we want to know that. Or if your child has that symptom. Heightened arousal and sensitivity, including, involuntary orgasms or orgasms while sleeping. We want to know that. We also want to know about sexual desire, high or low. We want to know about kids who masturbate a lot. We want to know about all sorts of things related to your sexual health, including whether you have a difficulty reaching orgasm. And as I said, pain with intercourse, the type of pain, what it feels like when on intercourse, does it actually hurt? Is it on insertion? Is it at completion? All those timing symptoms can be really helpful as well. And in addition to this, we want to talk a little bit about hot flashes. So they're not quite related to your genitals, but it's related to female reproductive health. Hot flashes can be really, really beneficial as a symptom. So what we want to know with this is, obviously it's hot. What does it feel like though? Is there anything aside from heat with it? How much do you sweat with it? Is there no perspiration with it? Where does the hot flash start and where does it radiate to? That can be a really, really beneficial one. What time of day does it happen? Does a hot flash trigger with an emotion, or does it come on its own? Anything make it better or worse? That's a really useful symptom as well. And then finally, Dr. Petersons, I don't know if you want to talk about this, anything related to infections can also, like BV or yeast infections, those type of symptoms are also really helpful.
Yeah, those are all good. And then, with the hot flashes, just if your period has been suppressed by hormones, or your hot flashes have been suppressed by hormones, or you've been doing birth control, things like that, or you had that stuff before and kind of masked it with birth control, it's important to kind of bring that up as symptoms that you had in the past before you kind of palliated it with.
Right. That's an important point. Thank you for bringing that up. And then finally, we want to know anything about breast pain or any nodules that you might have, if there's discharge from the nipples, especially obviously if you're not nursing. There are some medications that sometimes are prescribed to kids with PANS that can cause discharge from the nipples. And so we do need to take that into consideration and be always aware of the medications that you're on that could be contributing. But if you are having any discharge, that's what we need to know. What does it look like? What time of day does it happen? What's the volume? Is it green? Is it yellow? Is there pain associated with it? Where is the pain? What makes that better? What makes it worse? How do temperature things impact it? You think of like the type of things that you might even think of with mastitis. Is there swelling? Is there heat? Is there lumps? All of that can be really useful information for breast symptoms as well.